Hello, my name is Carly Bear. I'm a registered nurse at Sarasota Memorial Hospital. I'm currently in the RN to BSN program at State College of Florida, and today I will be performing my Heent assessment. I have a peer here with me. Can you state your name, please?
Kristen Bauer.
Okay, and Kristen, do you agree to be videotaped for the purpose of this assessment?
I do.
Okay, perfect. All right, so before I would perform my assessment, I have my hand hygiene here. I would knock on the door, come in, perform hand hygiene, wash my hands, put gloves on, provide for privacy if needed, and explain what I was doing to the patient. Okay. So I'm going to come in. Hi, my name's Carly.
Hi.
I'll be your nurse today.
Okay.
I'm going to be performing a Heent assessment, which is just kind of a neurological exam. It shows me that you're hearing everything right, seeing everything right, feeling everything. Just a little bit of your motor nerves, things like that, okay?
Okay.
Right. Can I see your wristband here?
Sure.
And can you repeat your full name and date of birth for me?
Yes, Kristen Bauer, 10/25/87.
Okay, and any allergies?
No.
Okay, perfect. And I would assess for her level of consciousness by asking a couple of questions. Kristen, do you know where you are today?
Yes, I'm in the hospital.
Okay, and do you know why you're here?
Because I was having trouble seeing.
Okay. And do you know what year it is?
2016.
Okay, perfect. So she's alert-oriented times 4. Level of consciousness is intact. So I'm going to start with just looking at her eyes. And I have a smelling chart here that I'm going to assess her vision with. So let me put this over here a little bit. Okay. All right, Christy, can you cover your left eye for me? And I'm going to be standing 20 feet away from the patient. Okay. And can you read this line 8 for me?
Yes, DEFPOTEC.
Perfect. Okay. And then with your other eye, here, same line.
DEFPOTC.
Perfect. Okay, so Kristen read both of those correctly, indicating that she has 20/20 vision. Okay, so next I'm going to take my pen light here and just take a look at her pupils. Kristen, can you look straight ahead for me? Okay, so her pupils are 3 millimeters in size, brisk, reacting to light. They are equal, round, and reacting and accommodating. So pearl is intact for her. Okay, and next I'm going to be performing the confrontation test. Kristen, if you can cover your left eye, I'm going to cover my right eye. And we're going to be just looking at each other. I'm going to take my fingers from different angles and see where she sees the fingers come into the line of vision. So just let me know when you see my fingers, okay?
Now. 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 Now.
Okay, perfect. Thank you very much. Okay, so I'll also be performing the swing test. If you can just look straight ahead for me. I'm just going to be taking the pen light across both eyes at the same time, and they're both staying constricted as the light passes her eyes. So her swing test is intact. Next I'm going to be assessing her extraocular muscles in her eyes. So I'm going to be, this is assessing 3, 5, and 7. Can you just follow my fingers with me? Both fingers with your eyes. Perfect. Okay. So her extraocular muscles are intact. Next I'm going to be looking at, I'm going to be using my ophthalmoscope to take a look at her. Look straight ahead for me, okay? Okay. And good. Okay. So when I was assessing her eyes, I didn't see any, her lens looked intact. There was no blood vessels out of place, no characteristics that seemed abnormal. Next, I'm going to be looking at her ears. So I'm going to just first look, before using any equipment, at her external ears, sort of palpate around, see if there's any masses, moles, anything like that. And I don't know anything. Is there any tenderness when I palpate your ears?
No.
No. Okay. Okay. And the size, shape, and color look intact. The color is pink, and her ears look good. I'm going to take a look inside. Okay. Now I'm just going to take a look in both ears, okay? Okay. Okay, so when I looked inside Kristen's ears, there was no abnormalities. There was a little bit of cerumen, which is normal, no redness, no drainage, anything like that. Okay, so next, and there's no inflammation, no edema. Next, I'm going to be performing the whisper test. So I'm going to just perform in both ears. I'm going to whisper one thing in your ear, and you just let me know what you hear, okay?
Okay. 1, 2, 3.
And
4, 5, 6.
perfect. Okay, so she heard what I said correctly. Okay, next I'm going to be performing the Weber test. So this is the tuning fork, the 512C. Okay, I'm going to place this on top of her head. You let me know if you can hear that or not. Yes? Okay. On this side,
Yes.
and then on this side.
Yes.
And that is the Weber test. Everything is intact and she can hear on all parts of her skull. The Renee test is going to be next. So I'm going to take this and put it on her mastoid process. Let me know when you can stop hearing this, Kristen.
No.
Okay. And then I'm going to put it perpendicular to your ear. Let me know when you can stop hearing that as well.
No.
Okay. Perfect. Okay, and she was able to hear on both, but more quickly on the mastoid process. Okay, so that's the ears. Now I'm just going to be taking a look at her mouth. If you can just open wide for me, I'm just going to take a look at your teeth and her mucous membranes. Okay, everything looks good. Her teeth are intact. Mucous membranes are pink and moist inside. And do you have any history of dental caries, bridges, crowns, anything like that?
No.
So no abnormalities as listed by her. I didn't see any in there, no inflammation or bleeding. I'm going to take a look and just ask you to say ah. Okay, so her uvula is there, her tonsils are there, intact. No ulcers or masses or inflammation is noted. Okay, Kristen, can I have you clench your teeth and smile for me? Okay, so I'm just going to be assessing. Keep doing that for me. Thank you. Okay, assessing here. This is assessing her cranial nerve 5. She has symmetry. There's no abnormalities, no masses, and no overbite. Okay, so next I'm going to be assessing the lymphatic system. These are just, her lymph nodes should not be present, and if there were present lymph nodes at these locations, there would have to be further testing done. Okay, Kristen, so I'm going to be looking at your pre-auricular lymph node first, okay? All right. In front of the ear, and post-auricular. There's nothing there. Okay. Her occipital lymph node. Okay, there's nothing there. Next, I'll be looking at the posterior superficial cervical, the anterior deep, and the superficial cervical. So you can just relax for me. I'm going to be looking at anterior, which is right in the front of her neck. Nothing there. Posterior and superficial. And nothing there as well. Next, I'm going to be looking at her submental, which is just under her chin here. Okay, nothing noted there. And so sublingual, I'll just be asking you to look under your tongue for the purpose of this assessment. I'm not going to feel, but I'm just going to look. I don't see any abnormalities there. And the supraclavicular is just going to be right here, above her collarbone. And no abnormalities there. Okay, so next, Kristen, I'm going to ask you to take this water and just take a drink from me and hold it in your mouth, okay? Okay, so this is going to be assessing for her thyroid gland. I'm just going to take a look here. I'm going to ask you to swallow. Okay. And that looks good. When she swallows, the thyroid gland is present there. So I've already assessed her level of consciousness. She appears, her behavior is appropriate to the situation and the age. Her emotional stability is intact. And then her speech and language are coherent. She's able to follow my directions. Everything is intact there. Next, I'm going to be looking at the proprioception and the cerebral function. Okay, so I'm going to ask you to put your hands on your knees and turn over to the base of your hands and back a couple times. Okay, so that is intact. Next, I'm going to ask you to just touch my thumb with your finger into your nose. Perfect. A little bit faster. And with your other hand. Perfect. So her motor nerves are in place. She's able to perform those. Next, I'm going to ask you to just stand up for me if you can. Okay. So she's going to stand here. I'm going to just stand behind her. Can you close your eyes for me, Kristen? Okay, perfect. So there's a little bit of swaying, which is normal for her. No unsteady gait is present. Can I ask you to take your shoes off and place your heel up on your knee and put it down your shin with both legs? Okay, and she's able to perform that as well. Okay, so that's good. So you can sit down for me. Okay. So next I'm just gonna take the eraser tip of a pencil. You can use a cotton swab, anything like this. I'm gonna ask you to just close your eyes, and I'm gonna be touching different parts of your face. Let me know where you feel, okay?
Forehead. Right. Left cheek. Right cheek. Chin.
And that's assessing for cranial nerve 5, which everything is present there. I'm going to just be assessing your joints. If you can close your eyes for me, let me know which way that I'm moving your joints, okay?
In, out, up, down.
Okay, perfect. And that was all correct. No abnormal temperature. I would make sure that her skin feels good. Everything in her face feels good. There's no abnormal